In this video we will briefly discuss about Ceftriaxone INJ. Subscribe and press the bell icon to be notified when I release a new video. Ceftriaxone injection is a medication used to treat various bacterial infections such as pneumonia, meningitis, septicemia, and infections of the bones, joints, and skin. It belongs to a group of antibiotics called cephalosporins and works by killing the bacteria causing the infection. Ceftriaxone injection is given by a healthcare provider, usually as an intravenous, IV, infusion or injection. The dosage and duration of treatment depend on the type and severity of the infection, as well as the patient's age, weight, and medical history. It is important to complete the full course of treatment, even if symptoms improve before the medication is finished. This helps to prevent the recurrence of infection and the development of antibiotic resistance. As with any medication, ceftriaxone injection can cause side effects. Common side effects include diarrhea, nausea, vomiting, headache, and pain or swelling at the injection site. Serious side effects such as allergic reactions, severe diarrhea, and liver or kidney problems are rare but can occur. If you experience any unusual symptoms while taking ceftriaxone injection, it is important to contact your healthcare provider immediately. Dose. The dose of ceftriaxone injection depends on the type and severity of the infection, as well as the patient's age, weight, and medical history. It is important to follow the dosage instructions provided by your healthcare provider. For most infections, the usual adult dose of ceftriaxone injection is 1 to 2 grams given once a day, either as an intravenous, IV, infusion over 30 minutes or as an intramuscular, IM, injection. The duration of treatment may vary depending on the infection and the patient's response to the medication. For children, the dose of ceftriaxone injection is based on their weight and is typically lower than the adult dose. The dose and duration of treatment should be determined by a pediatrician. It is important to complete the full course of treatment as prescribed by your healthcare provider, even if symptoms improve before the medication is finished. Do not change the dosage or stop taking ceftriaxone injection without consulting your healthcare provider. Side effects. Like all medications, ceftriaxone injection can cause side effects. Some of the common side effects of ceftriaxone injection include diarrhea, nausea and vomiting, headache, dizziness, abdominal pain, rash or itching, pain or swelling at the injection site, fever or chills. These side effects are usually mild and go away on their own as your body adjusts to the medication. However, if these side effects persist or become severe, you should contact your healthcare provider. In rare cases, ceftriaxone injection can cause more serious side effects such as severe allergic reactions, anaphylaxis, Clostridium difficile-associated diarrhea, a severe form of diarrhea, liver or kidney problems, blood disorders. If you experience any of these symptoms while taking ceftriaxone injection, it is important to contact your healthcare provider immediately. It is also possible to develop an antibiotic-resistant infection while taking ceftriaxone injection or other antibiotics. If you experience new or worsening symptoms while taking ceftriaxone injection, it is important to notify your healthcare provider right away. Precautions. Before taking ceftriaxone injection, it is important to inform your healthcare provider about any allergies, medical conditions, or medications you are currently taking. Ceftriaxone injection may interact with other medications or medical conditions, so it is important to discuss your medical history with your healthcare provider. Here are some precautions to take while using ceftriaxone injection. Allergy. If you have a known allergy to ceftriaxone or any other cephalosporin antibiotics, you should not take ceftriaxone injection. Pregnancy and breastfeeding. Ceftriaxone injection is generally safe to use during pregnancy and breastfeeding, but it is important to consult with your healthcare provider before taking this medication. Kidney and liver problems. Ceftriaxone injection can affect kidney and liver function. If you have kidney or liver problems, your healthcare provider may need to adjust your dosage or monitor you more closely. Bleeding disorders. Ceftriaxone injection can interfere with blood clotting and increase the risk of bleeding. If you have a bleeding disorder, your healthcare provider may need to adjust your dosage or monitor you more closely. Use in children. Ceftriaxone injection can be used in children, but the dosage and duration of treatment should be determined by a pediatrician. Use in elderly patients. Elderly patients may be more sensitive to the effects of ceftriaxone injection, and may require a lower dosage or more frequent monitoring. It is important to follow your healthcare provider's instructions for taking ceftriaxone injection and to report any unusual symptoms or side effects right away. Interaction. Ceftriaxone injection can interact with other medications or medical conditions, so it is important to inform your healthcare provider about all medications, supplements, and medical conditions you have before starting treatment with ceftriaxone injection. Here are some of the medications that can interact with ceftriaxone injection. Anticoagulants, blood thinners, such as warfarin. Ceftriaxone injection can increase the effects of blood thinners and increase the risk of bleeding. Probenecid. Probenecid can increase the level of ceftriaxone in the blood and increase the risk of side effects. Calcium-containing solutions. Ceftriaxone injection should not be mixed with calcium-containing solutions, such as Ringer's lactate, as this can cause ceftriaxone to precipitate and form clumps. Other antibiotics. Taking ceftriaxone injection with other antibiotics can increase the risk of antibiotic resistance. It is also important to inform your healthcare provider about any medical conditions you have, especially kidney or liver problems, as these can affect how your body processes ceftriaxone injection. It is important to follow your healthcare provider's instructions for taking ceftriaxone injection and to report any unusual symptoms or side effects right away. Overdose. An overdose of ceftriaxone injection can lead to serious side effects, including seizures, kidney damage, and severe allergic reactions. If you suspect an overdose or experience any unusual symptoms, seek medical attention immediately. The symptoms of a ceftriaxone overdose may include seizures, hallucinations, confusion, dizziness, nausea and vomiting, diarrhea, abdominal pain, kidney problems, severe allergic reactions. In the case of an overdose, treatment may involve supportive care to manage symptoms, such as intravenous fluids, medications to control seizures or allergic reactions, and close monitoring of kidney function. It is important to seek medical attention as soon as possible to prevent serious complications. It is important to follow your healthcare provider's instructions for taking ceftriaxone injection and to report any unusual symptoms or side effects right away. Do not change the dosage or stop taking ceftriaxone injection without consulting your healthcare provider. Thanks for watching the video.